As a patient, having a dental implant is literally the closest thing to replacing a natural tooth that's currently available. You can brush and floss and eat and do whatever you normally do without any alteration. With the other methodologies to replacing teeth, all of that is altered, and you can't quite manage things the way you do with an implant. The advantage from a functional perspective is that implant is completely stable. It doesn't move in any way. It's completely functional in terms of its aesthetics and your ability to chew. You also have a long-term advantage in that implant very rarely has problems associated with it. You don't have generally gum issues, you don't have issues with abscesses, and the implant crown itself is completely manageable. If it ever fractured or chipped or you had any issue with it, it can be easily repaired and replaced. So overall, it's a mechanism that allows for the most natural replacement of a missing tooth.